Hey guys, welcome to Pendentistry. Hope you all are doing good. I am Dr Ayshwarya with you for easy learning and better understanding. And yes, don't forget to subscribe and press the bell icon for the latest upcoming videos. Without further delay, let's get started. Bruxism. Bruxism is clenching, grinding of teeth. That is clenching and grinding of teeth when individual is not swallowing or chewing. When a person is not swallowing or chewing, then too he or she is clenching and grinding. At that time, it is known as bruxism. Clinical features of bruxism are facet pattern. Facet patterns are smooth, polished patterns occur when it occur during the rapid eye movement at the sleep time. Okay, during the sleep time, when there is a rapid eye movement, at that time facet pattern occurs on the teeth. Leads to sensitivity. Bruxism leads to sensitivity. Decay of the tooth, fracture, loss or missing tooth. It may cause fracture, it may cause decay, or it lead to sensitivity or missing tooth. Long-term Bruxers experiment jaw tenderness when the person is having long term bruxism. Okay, at that time he or she is experiencing jaw tenderness, jaw pain, fatigue of facial muscles, headache, neck ache, ear ache, and hearing loss. Okay, damage to the TMJ. Bruxism leads to damage to the TMJ, loosening or drifting of the tooth takes place. Malocclusion or load bite. Bruxism causes malocclusion or load while biting. There may cause a gingival recession. Gingival recession also occur during the time of the bruxism. Etiology of the bruxism. Due to mild occlusion disturbance, they may cause a bruxism. When there is a GIT disturbance, it causes bruxism. Endocrine disturbance causes bruxism. Emotional stress. When a patient is having emotional stress, he or she may get a bruxism disorder. It mostly happens in watchmakers. Watchmakers mostly suffer this disease. What are the management of the bruxism? Appliances for maxillary stability mostly used. Mostly appliances are used for the maxillary stability. Anti-anxiety drugs are used and muscle relaxant. Due to the TMJ pain, there of facial pain, muscle relaxants are given and anti-anxiety drugs are given to the patient. Thank you for watching Pendentistry. To know more about me, links are in description box. Don't forget to like, subscribe and hit the bell icon for the latest videos.